Hey, you guys, it's Dr. Satcher. In this video, we're talking about type 2 diabetes. Type 2 is, in my opinion, one of the most poorly managed conditions of healthcare. It's very poorly managed. Why? Well, you go in, you check all the boxes, you fill out the forms the doctors ask you to fill out. They do some lab work. Okay, take this medication, this chemical cover up, take this insulin, whatever it might be. They ignore the underlying cause. Now let's mention the GLP-1s here now too, because a lot of you are on those. And once you start on those, if you don't change anything, you'll have to be on that the rest of your life. Now the question is type 2 diabetes reversible? And it is. We've been doing this for almost 25 years at this point. So let me give you a quick background. So my name is Dr. Serena Satcher. I've been in practice for almost 34 years. I've had thousands of patients come through my functional protocols with amazing success. We have a very, very high success rate. If you follow the protocols, what you need to understand about type 2 diabetes is that you have to fix the cell. The cells are sick. You have to look at things from a cell perspective because your cells make up your tissues and your tissues make up your organs. So if your cells are damaged or if they're sick, if they're inflamed, if they're broken, your tissues are going to be broken and then your organs are not going to function properly. So in order to get well, you have to fix the cell. Write that down. In order to get well, you have to fix things at the cellular level. We have to look at the receptors. We have to look at inflammation. We have to look at lifestyle factors. We have to do what functional medicine doctors do. And we are detectives. We dig, find, and work towards fixing the underlying root cause. Solving the puzzle, not just spending 10 or 15 minutes with you and now giving you a prescription, a pill to take, come back in 6 weeks. Nobody's telling you what to do. They may send you to a registered dietitian, but the registered dietitian works from recommendations from the American Dietetic Association. They're letting you eat whatever you want to eat, and you know that's not right. And as long as you take your medicines, they tell you you can do what you want. Well, you've been doing that all this time and you can see that doesn't work. And you know in your mind that that doesn't work. We're not just trying to fix a bunch of blood work. We're trying to get people healthy. So we have to look at foods. We have to look at your lifestyle. We have to look at nutrients. We have to look at toxins, bad fats, sugars, hidden sugars, inflammation, cell health, and gut health. We have to look at things from a holistic perspective, root cause perspective, a global perspective. You're more than just a lab marker. We have to look at the big picture, and that is why what we do works so well. So if you're struggling with type 2 diabetes and you want help getting this reversed, remember, just look at some statistics. Here's the scary thing about type 2 diabetes. There's 37 million Americans that have it. That's 1 in 10 people, 1 in 10 who have full-blown type 2 diabetes. So if you're thinking that you're alone, you're not alone. There's a huge problem for a lot of people. And it's because the standard American diet is full of sugar. It's full of carbohydrates that are processed, essentially sugar in disguise. So the standard American diet, we call this the SAD diet, but it's the fastest way to destroy your health. It's the fastest way to disease and dysfunction. And usually the end result is type 2 diabetes. So we have 37 million Americans that have it, but the scary part is that we have 88 million that have prediabetes or some kind of insulin resistance that hasn't been diagnosed yet. We have 88 million Americans with prediabetes. That's 1 in 3. 1 in 3 have full-blown prediabetes. Let's just call it prediabetes, where if they don't take action within 5 years, they're going to eventually graduate into full-blown type 2 diabetes. With type 2 comes consequences. You can get complications with your eyes going bad, your kidneys going bad. Really, it's anywhere where you have tiny blood vessels, numbness and tingling in the ends of your fingers and in your toes. Also in those private parts, you can get neuropathy. I had an aunt that had her leg amputated at the knees. This is a nasty, nasty condition, and it's fixable. So this was sad. The occurrence in my family, that was reversible. If your medical doctor said, no, you can't fix it, it's time to get a new doctor. You've got to get an evaluation that points you towards the root cause and what to do, because this is reversible. Get another opinion. We've been doing this almost 2 decades at this point. So your next step, if you want some help, what I want to do is offer you a one-on-one discovery call. This is not a high pressure, pushy sales call. This is not that. This is simply a chance to get to know each other, ask some questions. We'll ask you some questions, determine if what we have would make sense for you. I use an analogy. If I'm trying to go from California to New York and I don't have a map, I don't have a blueprint, a way to get there, how successful do you think I'd be? I'd be all over the place. I'd be lost, I'd be frustrated, I'd be confused. But if I had a straight line path, do this, do this, do this, avoid this. If I had a straight line path, a blueprint, a map to get there, that's what we have with type 2 diabetes, and I want to give it to you. So understand, either myself or one of my partners will be giving you a call. I have a team, we get the job done when it comes to type 2. But again, your next step, click the button, fill out the form. The small fee can go towards your program if you decide to move forward on the day of your call. Either myself or one of my partner doctors or practitioners will be giving you a call at that time that you choose. So you pick the date and time, we'll give you a call then. Thanks for watching, and be ready when you show up, fill out your forms, and so we can have a really productive discussion and make the most of your time. I've enjoyed meeting you. Bye-bye.